Good afternoon, ma'am. Good afternoon, friends. So, today we will discuss about a new topic, that is lung tumor or lung cancer. So, lung carcinoma is a malignant lung tumor which is characterized by uncontrolled cell growth in tissues of lung. If left untreated, this growth can spread beyond the lung by a process of metastasis into nearby tissues or other parts of the body. So, lung carcinoma, which is a malignant lung tumor that is characterized by uncontrolled cell growth within the tissues of lungs, and if it is left untreated, this growth can spread beyond the lung by a process of metastasis into nearby tissues or distant organs or any other parts of the body. So that is lung cancer. So next we can see the incidence of lung tumor. So lung tumor is a leading cause of cancer related death in United States, and it accounts for 28% of all cancer related death. And in India, the lung cancer constitutes 6.9% of all new cancer cases and 9.3% of all cancer related deaths in both sex. Next is the incidence is estimated to be about 6.6 per 1 lakh in male population and 1.7 per 1 lakh female population. So next is about the etiology. So the etiology, first one is chronic smoking. So the chronic smoking is the most important cause or risk for cause for developing lung cancer. So the smoking is responsible for about 80% to 90% of all lung cancer. Usually the tobacco smoke contains 60 carcinogens in addition to these substances such as carbon monoxide and nicotine. So these carcinogens which may interfere with the normal cell development. And also when a person is exposed to a tobacco smoke, that causes changes in the bronchial epithelium. And if the person discontinues or stops smoking, these cells may return to normal. So it means that the risk for lung cancer, which is gradually decreases with the smoking cessation. Next is about the the risk for developing lung cancer, which is directly related to the total exposure to tobacco smoke, and it is measured by the total number of cigarettes smoked in a lifetime and age of smoking onset, depth of inhalation, tar and nicotine content, and use of unfiltered cigarettes. So these all are the factors which affecting the risk for developing lung cancer. So the risk for developing lung cancer, which is directly related to the total exposure to tobacco smoke, and it can be measured by, that is the total number of cigarettes smoked in a lifetime, age of smoking onset, and depth of inhalation, tar and nicotine content, and the use of unfiltered inhalation. And another thing is that is both smokers and non-smokers can develop this lung cancer. So that is one term, that is side stream smoke. Side stream smoke means the smoke from burning cigarettes, so which contains the same carcinogens which is found in the mainstream smoke. The mainstream smoke means the smoke is inhaled and exhaled by the smoker, that is mainstream smoke. So the side stream smoke has contained the same carcinogen which is found in the mainstream smoke, and this two, that is the combination of these side stream and mainstream smoke is together called second hand smoking or environmental tobacco smoking. So this second hand smoke which created increased health risk for developing lung cancer in non-smoking adults and children. So that is the about smoking. So smoking is the most important cause for developing lung cancer. Next one is exposure to polluted air. So high level of air pollution, that is another risk factor for developing lung cancer. Next is nasal exposure to radioactive gases and substances. So uh, the high level of radiation or especially radon exposure, so that or exposure to any radioactive gases, so that increases the risk for developing lung cancer. Next is exposure to industrial asbestos. So the prolonged exposure to this asbestos, heavy industrial metals or ionizing radiations called dust, nickel, uranium, chromium, formaldehyde, arsenic. So all these can increase the risk for lung cancer, especially in smokers. Next is hereditary. Hereditary is that is also one of the risk factor which has a role in some patients for developing this lung cancer. Next is passive smoking. So passive smoking means that is breathing in other people's smoke, that is inhaling the other people's tobacco smoke or cigarette smoke, that is called passive smoking. So passive smoking is also an risk factor for developing this lung cancer. Next is genetic mutation. So genetic mutation, primarily the lung tumors are believed to be arise from the mutated epithelial cells. So the mutation which is occurs due to the presence of these carcinogens. In etiology we have seen the different type of carcinogens. So these carcinogens which causes the mutation. So these mutated epithelial cells are believed to be a cause of developing lung cancer. So this mutation is also influenced by various genetic factors, and it is also promoted by the epidermal growth factor. So usually the cell growth which occurs very slowly, it may take 8 to 10 years for a tumor to reach a size of 1 centimeter. So it is a slow gradual growth of tumor. It may take years to develop a size of 1 centimeter. So that is about the genetic mutation. So these are the etiological factors of lung tumor. That is, first one is chronic smoking, next exposure to polluted air, and next is nasal exposure to radioactive gases, and exposure to industrial asbestos. Next is hereditary factors. Next cause is passive smoking and genetic mutation. So next we will move on to the gender differences in lung cancer. So gender differences, that is first in men. So in men, more men than women are diagnosed with lung cancer. Usually men are mostly diagnosed with lung cancer. More men than women die from lung cancer, and male smokers are 10 times more likely to develop lung cancer than non-smokers. Men with lung cancer have a worse prognosis than women. Usually the men have a worse prognosis than women. Next is lung cancer incidence and deaths are decreasing in men. In men, the lung cancer incidence and deaths are decreasing. Next is in women, the lung cancer incidence and deaths are increasing. So in men, we have seen that the incidence and deaths of lung cancer which is decreasing, but in women, the lung cancer incidence and deaths are increasing. Women develop lung cancer after few years of smoking than men. Women develop lung cancer at a younger age, and non-smoking women are greater risk for developing lung cancer than men. Women with lung cancer live on average 12 months longer than men. So next we'll move on to the pathophysiology of lung cancer. So pathophysiology, first one, it begins from due to the etiological factors or due to the exposure to these carcinogens that leads to the irritation and damage to the cell structures. So that results, and as the exposure continues, the changes become irreversible and causing gene mutation in DNA. So that leads to the inactivation of tumor suppressor gene and activation of oncogenes, and that leads to the uncontrolled cell division and decreased apoptosis. So apoptosis means is a type of cell death in which there is a series of molecular steps takes place that leads to the cell death. So in cancer, the purpose of apoptosis is to eliminate the cells that contain potentially dangerous mutation. So in cancer, this apoptosis helps to eliminate the mutated cells. So here in lung cancer, that is there is an inactivation of tumor suppressor gene and activation of oncogenes occurs. So that leads to the uncontrolled cell division and decreased apoptosis. That results in hyperplasia of lung parenchymal cells that results in lung carcinoma. So these are the pathophysiological changes occurs in lung cancer. So due to the etiological factors or due to the exposure to these carcinogens, that results in there is an irritation and damage to the cell structures. So as the exposure continues or that causes changes, and the changes become irreversible and causing gene mutation in DNA, which results in inactivation of tumor suppressor gene and activation of oncogenes, which leads to the uncontrolled cell growth and decreased apoptosis that leads to the hyperplasia of lung parenchymal cells, which results in lung cancer, development of lung carcinoma. So next we can see the types of lung cancer. So the types of primary lung cancer. Primary lung cancer means that is the lung, the cancer growth which starts within the lungs. And secondary lung cancer, the cancer starts other parts of the elsewhere in the body and can spread into the lungs. That is secondary lung cancer. So we have can see the types of primary lung cancer. So the primary lung cancer, which is categorized into two broad categories, that is non-lung cancer, which is contribute to 80% of lung cancer, and small cell lung cancer, that is about the 20% of lung cancer. So the major types of lung cancer, that is small cell lung cancer and non-small cell lung cancer. So the under small cell lung cancer, other subtypes which include small cell carcinoma and combined small cell carcinoma or mixed small cell and non-small cell carcinoma. Under non-small cell lung cancer, that is, so the majority of lung cancer are non-small cell carcinoma, that is about 80%. Under this, there are three subtypes, that is first one is adenocarcinoma, next is squamous cell carcinoma, and large cell carcinoma or undifferentiated carcinoma. So the non-small cell carcinoma, which contribute to 80% of lung cancer. So under this, squamous cell carcinoma. So we can see what are the characteristics of small cell carcinoma. So they are rapidly growing and accounts for 20% to 30% of lung cancer, which are centrally located and producing early symptoms of non-productive cough and hemoptysis, and it does not have strong tendency to metastasis. Next is adenocarcinoma. So in adenocarcinoma, there is a moderate growth. It accounts for 30% to 40% of lung cancer, and it is most common lung cancer in people who have not smoked, and it is peripherally located and often has no clinical manifestations until widespread metastasis occurs. So this adenocarcinoma has moderate growth, but in squamous cell carcinoma there is a slow growing, and adenocarcinoma account for 30 to 40%, which is mainly seen in non-smokers and it is peripherally located and often has no clinical manifestations until widespread metastasis occurs. So next subtype under this non-small cell lung cancer, that is undifferentiated carcinoma, large cell carcinoma or undifferentiated carcinoma, which is rapidly growing, account for 10% of lung cancers, and it is composed of large cells which are anaplastic and often arise in bronchi. These are highly metastatic via lymph nodes and blood. And next is another major type of lung cancer, that is small cell lung cancer. So under small cell lung cancer, there is a small cell lung carcinoma that is very rapidly growing, account for about 20% of lung cancer, which are most malignant form of lung cancer, and it spreads via lymphatics and bloodstream, and it frequent metastasis to brain, and it is also associated with the endocrine disturbances. So these small cell lung cancers are very rapidly growing and highly metastasis, and it spreads mainly through lymphatics and hematogenous, that is blood route, and it has a tendency frequent metastasis to brain, and it is mainly associated with endocrine dysfunctions. So next is about the other types of lung tumors. So about 95% of lung tumors are comprised of the small cell and non-small cell lung cancer, and the remaining 5% include other type of lung tumors. In that, first one is hamartomas. Hamartomas, which are slow growing, most common congenital benign tumor, which is composed of fibrous tissue, fat and blood vessels. Next type, that is mucous gland adenoma, which is a benign tumor that is arising from the bronchi that consists of columnar cystic spaces. And next is mesotheliomas. So mesotheliomas these are either malignant or benign, and it may originate from visceral pleura. So these are the different type of other type of lung tumors, that is hamartomas, mucous gland adenoma and mesotheliomas. So next is about the clinical manifestations of lung cancer. So the clinical manifestations of lung cancer, which are usually non-specific and appear late in the disease process, the symptoms that may be depend upon the type of primary lung cancer and its location and its metastatic spread. So the lung cancer, which is frequently manifest as a lobar pneumonia, and it does not respond to treatment. So that is the frequent manifestation of that is lung cancer, that is lobar pneumonia, but it does not usually respond to treatment. So one of the most common symptoms of lung cancer, which is reported at first, that is a persistent cough, and next is blood tinged sputum or hemoptysis, which may be produced because of bleeding that is caused by cancer, and the patient may complain of also have dyspnea, wheezing, chest pain. So this chest pain occurs, it may be localized. If patient may have chest pain that is localized or unilateral, or it may be ranging from mild to severe. So these are the major most common manifestations of lung cancer, and other late manifestation. These late manifestations are non-specific and systemic symptoms. So in that first one, anorexia, fatigue, weight loss, nausea, vomiting, and also hoarseness of voice. It may be due to the result of laryngeal nerve involvement. Next is unilateral paralysis of diaphragm, dysphagia and superior vena cava obstruction. So all this may occur due to the intrathoracic spread of this malignancy. And other symptoms that is include palpable lymph node in the neck or axillae. Next is pericardial effusion, cardiac tamponade, and dysarrhythmia. It may be due to the mediastinal involvement of tumor. So that leads to the pericardial effusion, cardiac tamponade, and dysarrhythmias. So these are the common early and late manifestations of lung cancer. So next is paraneoplastic syndrome. So paraneoplastic syndrome, that is it may be caused by hormones, cytokines, or enzyme, or by the antibodies in response, antibodies that destroy the healthy cells. So the paraneoplastic syndrome, which is maybe caused by the hormone, cytokines, or enzyme which is secreted by the tumor cells, or by the antibodies which are produced by the body in response to tumor. So it destroy the healthy cells. So the paraneoplastic syndrome may manifest even before the malignancy is diagnosed. So the usual symptoms include hypercalcemia, syndrome of inadequate antidiuretic hormone secretion, adrenal hypersecretion, polycythemia, Cushing syndrome. So these are the manifestations which may appear before the diagnosis of malignancy. So next is about the diagnostic studies for lung tumor. So first one is history and physical examination. Next is chest x-ray. So chest x-ray is the initial diagnosis test which is used for patient who are suspected with the lung cancer. And the x-ray may initially be normal or that identify lung masses. And also it shows the evidence of metastasis to the ribs or vertebrae, or it shows the evidences of pleural effusion. So next is biopsy. So biopsy, the cells for biopsy can be obtained by CT guided needle aspiration or through bronchoscopy or mediastinoscopy. So next one is cytologic study of bronchial washing and pleural fluid. Next is CT scan, MRI scan, PET scan. So CT scan, which is used for further evaluation of lung masses, and CT scan, which can helps to identify the location and the extent of this cancer growth and the mediastinal involvement, and also the mediastinal and also lymph node involvement can be identified through the CT scan. And the MRI and PET scan, which is used to evaluate the stage of lung cancer. Next is mediastinoscopy and bronchoscopy for obtaining biopsy specimen. Next is video assisted thoracoscopic surgery. So this video assisted thoracoscopic surgery, in which that is a rigid scope with a distal lens which is inserted into the pleura, and we can see the images on a monitor, and it also allow for obtaining any specimen. For that, this video assisted thoracoscopy surgery may use. Next is pulmonary function test, liver function test. So this pulmonary function test and liver function test and complete blood test may be done in patient with lung tumor. Next is transbronchial or percutaneous fine needle aspiration. So these are the major diagnostic studies for patient with the lung cancer. So next we move on to the staging of lung cancer. So staging of non-small cell lung cancer, which is performed according to the TNM, that is tumor non-metastatic staging system. So under this, the tumor is grouped into 4 stages: stage 1, stage 2, stage 3 and 4. So in each stage there are 2 subtypes, that is A and B. So here this chart shows the classification of this lung tumor. So here there is stage 1, 2, 3 and 4. So in each stage comprised of 2 sub stages or subtypes. So initially the tumor that is less than 3 centimeter and it is surrounded by lung or pleurae, and there is no tumor more proximal than lobe bronchus. And in stage 2 there is a nodal involvement of ipsilateral peribronchial or hilar nodes and also the intra and pulmonary nodes by direct extension. And in third stage there is an involvement of ipsilateral mediastinal or subcarinal nodes. And in stage 4, that is there is a distant metastasis occurs. So next is about the management of lung tumor. So management mainly include first one is surgery. So surgical therapy, the surgical resection, which is the treatment of choice in non-small cell lung cancer, that is from stage 1 to stage 3A, without any mediastinal involvement. So the resection which provides a greater chance for cure. So the type of surgery, the lung surgery, which include wedge resection, lobectomy and pneumonectomy. So the wedge resection, that is wedge resection means a removal of small localized lesion that occupies only a part of segment. So that is wedge resection. Next is lobectomy. Lobectomy is the removal of lobe of lung. So this part of the lung can be removed, and it is possible to remove 1 or 2 lung lobe, that may be called bilobectomy. Next is pneumonectomy. Pneumonectomy means removal of entire lung. So it can be done only when the lobectomy or segmental resection will not be remove the diseased lung. So in this case we'll go for pneumonectomy. So this picture showing the different types of lung surgery. So next is radiation therapy. So radiation therapy which is used as a treatment of both non-small cell lung cancer and small cell lung cancer, and it is also used as a curative therapy and palliative or as adjuvant therapy in combination with the surgery or chemotherapy or targeted therapy. So under that this radiation therapy helps to relieve the symptoms of dyspnea, hemoptysis, and also helps to treat the superior vena cava syndrome. So the one type of radiation therapy, that is stereotactic body radiotherapy. So it is a new lung cancer treatment. It is a type of radiation therapy that uses high dose of radiation delivered, which is delivered to accurately to the tumor outside the central nervous system. So this stereotactic body radiation therapy, it requires spatial positioning procedures and radiologic technique, and higher doses of radiation therapy can be delivered to the tumor to a small part of health. Only a small part of healthy lung tissue is exposed. So this therapy is given over 1 to 3 days. So next is So the common complications of this radiation therapy, which may include esophagitis, skin irritation, radiation pneumonitis. So next is chemotherapy. So chemotherapy, which is used for the primary treatment of both small cell treatment for small cell lung cancer. In non-small cell lung cancer, the chemotherapy is used as a treatment of non-resectable tumor or as an adjuvant therapy to surgery. So the most commonly, there are a variety of chemotherapy drugs are used. That is, a multi-drug regimen is used in lung cancer treatment. So the major drugs, which include etoposide, paclitaxel, cyclophosphamide, ifosfamide, etc. Next is targeted therapy. Targeted therapy uses the drugs that blocks the growth of molecules which is involved in specific aspects of tumor growth. So the most commonly used drugs, that is, include cetuximab and osimertinib and necitumab. So these are all the targeted therapeutic drugs. Next is immunotherapy. So immunotherapy that can shrink some tumor cells and slows the growth. So it mainly involved the drugs mainly used are nivolumab and primolumab. Next is palliative therapy. Palliative is a end life therapy for so this patient without a poor prognosis or non-curable lung cancer patients may taken for palliative therapy. So, and other therapies apart from this surgical therapy and radiation therapy, other therapies mainly include prophylactic cranial radiation. So this prophylactic cranial radiation, which is used in patient with small cell lung cancer which has early metastasis, especially to the central nervous system. So the most chemotherapy drugs which does not penetrate into the blood-brain barrier. So the patient is a risk for cerebral metastasis after a successful systemic treatment. So the prophylactic radiation has been shown to decrease the incidence of cerebral metastasis and also improve the survival rate in patients with limited small cell lung cancer. So next is bronchoscopic laser therapy. So this bronchoscopic laser therapy is possible to remove the obstructing bronchial lesions. So the laser, that is thermal energy, is transmitted into the targeted tissue. It is a safe and effective method of endobronchial obstruction from tumor. Next is photodynamic therapy. So photodynamic therapy is a treatment from early stages of lung cancer that uses a combination of drug and a specific type of light that kills the tumor cells. So the porphyrin sodium, which is the most commonly used photosynthesizer, which can be injected into intravenously and selectively concentrate the tumor cells. Next is about the airway stenting. It's another type of treatment modality, that is airway stenting. The stents are used alone or in combination with other techniques for relieving this dyspnea, cough, and a respiratory insufficiency. So the advantages of this airway stent is to support the airway wall against collapse or external compression and can delay the extension of tumor into airway lumen. So next is radiofrequency ablation. So in radiofrequency ablation therapy, that is used to treat the small non-small cell lung carcinoma, so which are nearer to the outer edge of lungs. So in this therapy, it is used as an alternative to surgery. That is, who are not the inpatient who are not candidate for surgical therapy, and it is done as an outpatient procedure under local anesthesia. Here a thin needle-like probe which is inserted into the skin into the tumor, and CT scan which is used to guide the placement of this probe, and an electrical current is then passed into the probe, and that heats and destroy the tumor cells. So that is the that is happening in radiofrequency ablation. So these are the other type of therapies which is commonly used in lung cancer treatment, that is prophylactic cranial radiation, bronchoscopic laser therapy, photodynamic therapy, and airway stenting and radiofrequency ablation. Next is about the nursing management. So nursing management, that is nursing assessment. Next is managing symptoms. So managing symptoms, so the nurse usually instruct the patient and family about the potential side effect of specific treatment, and also helps to plan prepare strategies to manage these problems, and also instruct the patient and family to prepare strategies for managing symptoms such as dyspnea, fatigue, nausea, vomiting. So next is relieving breathing problems. So usually the patient with lung cancer have different type of breathing problems. So we have to teach the patients about the airway clearance techniques, including that deep breathing exercise, chest physiotherapy, directed cough, suctioning. Suctioning can be done in case of excessive secretions, and also bronchodilators medication may provide to the patient for that promote bronchial dilation. And usually when the tumor enlarges, that spreads and involves the large area of lung, it may result in impaired gas exchange and breathing problem. So in this stage, supplemental oxygen may be given. So next is reducing fatigue. So fatigue is a common symptoms that may be experienced by the lung cancer patient. It may be related to this disease itself or cancer treatment and complications. So we have to educate the patient about the energy conservation activities and help the patient in their daily activities of daily living, and guided exercises can be recommended. So next is about the providing psychosocial support. So another important part of nursing care, that is providing lung cancer, providing psychosocial support. So identification of potential problems, and also we have to find out the resources for patient and family, and also the nurse must help the patient and family to deal with poor prognosis and a relatively rapid progression of this disease. Next is lifestyle modifications. So lifestyle modification mainly focusing on behavioral modification, that is modeling healthy behavior by not smoking and promoting smoking cessation programs, and actively supporting education and policies changes related to smoking. So that is lifestyle modification. Next is care of patient undergoing chemotherapy and radiation therapy. So we know that the patient undergoing chemotherapy and radiation therapy may have different problems, general problems mainly related to their nutritional status and skin problems. So we have to provide dietary modification and skin care to the patient undergoing chemotherapy and radiation therapy, and also teach the care of patient with chemotherapy and radiation therapy. Next is care of patient undergoing thoracic surgeries. So it mainly include preoperative and postoperative nursing care management. So if a patient is undergoing any thoracic surgery or lung surgery, so the preoperative management mainly include, that is, we have to discuss about the procedure or about the surgery to the patient and give full provide full explanation about the procedure, including intubation, anesthesia, and chest tube drainage system. So all these should be discussed with the patient before surgery, and all routine preoperative checkup that should be done, including blood investigation and other diagnostic tests before surgery, and blood transfusion. So blood transfusion may be done preoperatively. Some patient may require this blood transfusion before surgery based on their HB hemoglobin level, and preoperative teaching should be done regarding cuffing and deep breathing exercise, arm exercise, and early ambulation, and also the pre-anesthetic checkups and all other general measures for surgery should be done before this chest surgery or lung surgery. Next is about the postoperative management. Postoperative management, patient is usually patient is on mechanical ventilator after surgery. So we have to maintain a patent airway. Next is monitor vital signs in every 50 minutes until the patient is recovered from anesthesia. And also patient is attached to the cardiac monitor for continuous observation, and central venous pressure, it should be used for hemodynamic monitoring. And also after extubation, the humidified oxygen which is given by cannula, which is usually at 6 liter per minute, and maintaining or promoting the nutritional status by providing IV fluids, and also monitor the incision site for bleeding and for subcutaneous emphysema. The patient is kept flat in bed or with the head is slightly elevated until the BP is stabilized into a preoperative level. So once the BP is stabilized, we can provide a semi-Fowler's position, and the pillow should be under head and neck. Next is initiating deep breathing and cuffing exercise, and the patient should be helped to cough in every hour, and also encourage the use of incentive spirometry, and suctioning may be done if the secretions are accumulated in the tracheobronchial tree, and also promote the abdominal breathing that may improve ventilation without increasing pain and assist in coughing, and analgesic should be given as required and for the first 48 hours, and initiating passive arm exercise and range of motion exercise. And next is nutritional status should be maintained by providing IV fluids, and slowly it may progress into general diet if patient is tolerated. So next is observe for the surgical incision site for dressing and dressing site for bleeding, and also periodically observe for signs of bleeding. Next is carefully monitoring the patient for developing subcutaneous emphysema. If small air leaks which occurs that may reabsorb over time and that does not cause any problem. If the subcutaneous emphysema is worsening, the chest tube is changed and with a larger decompressing uh, tube may be inserted. Larger drainage tube may be inserted. Next is maintaining a chest tube and drainage system for proper functioning. So we have to continuously monitor for the chest tube drainage system and for proper functioning. So these are the major postoperative care for a patient with patient undergoing lung surgery. So next is about the nursing diagnosis. So nursing diagnosis mainly include ineffective airway clearance related to increased tracheobronchial secretions and presence of tumor, ineffective breathing pattern related to decreased lung capacity and presence of space occupying lesion, impaired gas exchange related to a tumor obstructing airflow, airway related anxiety related to lack of knowledge of diagnosis or unknown prognosis. Next is grieving related to new cancer diagnosis and lack of knowledge about the disease process and therapeutic regimen. So these are the common nursing diagnosis related to lung cancer. So till now we have discussed about lung cancer and its incidence, etiological factors, pathophysiology about lung cancer and the clinical manifestation, diagnostic studies and management, both medical, surgical and nursing management of lung cancer, nursing diagnosis. So this is about lung cancer. So thank you, ma'am. Thank you all.